Good morning, everyone. So I would like to thank APO, IOS, and Dr. Indaman Rastogi, sir, for providing me the opportunity. So my talk is about collaborative models for addressing blindness, different approaches. So I will begin with the famous quote of Helen Keller: "Of all the senses, sight must be the most delightful." So we know that vision is the most dominant of our senses and plays a critical role in every facet of and stage of our life. So according to WHO, at least 2.2 billion people globally have a visual impairment, and out of these 1 million cases, this impairment could have been prevented or has yet to be addressed. And coming to the Indian scenario, so to assess the present status of blindness and visual impairment in India, the Ministry of Health and Family Welfare, it conducted the National Blindness and Visual Impairment Survey in the year 2015 to 19 using the rapid assessment of blindness, avoidable blindness strategy in individuals above 50 years across 31 districts of India, and the results estimated the national wide prevalence of blindness at 1.99%, and out of that cataracts were the main cause, accounting for 66.2%. So these are the definitions which are used, that has been covered by Dr. Nalini ma'am, and we can see that 85% of the blindness is avoidable or preventable. So coming to the definitions, the two have been covered. So what should be the approach? How we can approach this burden? So there are two ways. Either we should continue to do what is being done and has been giving good results, and second is we should strengthen the ongoing activities and adopt innovative strategies. So there are certain challenges also. The first and the foremost and the biggest, according to me, is the inequality in the workforce distribution. India has around 15 ophthalmologists per million population and 39.1 optometrists per million population, but there is a significant disparity between urban and rural areas. Urban areas have a ratio of ophthalmologists of 1 per 10,000, whereas in rural areas we have only 1 per 2.5 lakh population. So there are certain obstacles also in reducing this preventable blindness at the consumer end. What are they? So there is less utilization of the eye care services due to less awareness, low literacy levels, low socioeconomic status, older age, geographical barriers like hilly areas, desert areas, and tribal areas, lack of transportation facilities, lack of social support such as finding an escort to or obtaining permission from the family members, especially husbands, for women patients. So these are the major obstacles, and how we can approach these. So the rational approach would be divided into 5 parts. First is by raising the awareness. So a comprehensive public awareness campaign is required to educate people about the preventable causes of blindness, about the necessity of regular eye examinations, and the availability of the free or low cost eye care services, and this can be done through multimedia marketing, community engagement programs, and collaboration with local organizations. In addition, regular IEC activities, they should be taken yearly all around on World Glaucoma Week, Eye Donation Fortnight, and World Sight Day throughout the country. So these events, they highlight the need to healthy lifestyle for prevention of avoidable blindness. Second is to increase the access to the eye care services. So India must invest more in eye care facilities in neglected and unreached areas to overcome the urban-rural divide. So this can be done through mobile eye clinics and teleophthalmology. The government should collaborate with NGOs and commercial institutes to guarantee that quality eye care is provided to all. And there should be continuous emphasis on primary eye care by establishing vision centers in all PSCs. There should be development of mobile ophthalmic units in district levels for patient screening and transportation. And to make eye care more comprehensive, besides cataract surgery, there should be provision of assistance to other eye diseases like glaucoma, childhood blindness, corneal transplantation, etc. And more involvement of the private practitioners and NGOs in the program. A word about teleophthalmology. We know it is the latest tool in utilization of the diagnostic and therapeutic management of eye care. So India has been a pioneer in this development as well as application of this practice. So there are certain successful models like teleophthalmology for control of diabetic retinopathy. Arvind Eye Care and Shankara Nethralaya, they were the pioneers, and they were held to a larger extent by ISRO and World Diabetic Foundation. And one more example is teleophthalmology in the management of ROP. So Narayana Nethralaya in Karnataka started this KID ROP program for the diagnosis and management, and it was such a success that the government of Karnataka adopted it under its rural health scheme. And more about public-private collaboration, this has been discussed beautifully in previous lectures. So I will quote some successful global models like Vision 2020. And coming to India, there are two states, Madhya Pradesh and Maharashtra, where the collaboration of NGOs and government, it took beautifully, and they conducted many surgeries and helped in reducing the cataract backlog. And the best to me is the declaration of India free from trachoma by the World Health Organization on 8th October 24. So this was a big feast of victory for us, and this is the best example of private public private partnership. Third is to subsidize and provide subsidized and free eye surgery. India is already doing this. So in India, free eye surgeries are available through government schemes like Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, National Program from Control of Blindness under Netra Jyoti Abhiyan, ECHS, CGHS and state-sponsored health initiatives, and through charitable organizations and hospitals. There is need to involve more corporate sectors to execute corporate social responsibility for cataract surgery. These are some government and some state level schemes which are providing free surgeries. A word about Mission Mode Cataract Surgery Campaign or Netra Jyoti Abhiyan. So this was launched by the government in May 2022, so as to reduce the backlog or to clear the backlog of eligible cataract cases by allotting yearly targets to each state and union territory for the year 2025. I think this should be taken in the next lecture. So another method is to replace the traditional camp approach by this hub and spoke model. So the traditional approach, we know it was very tricky. It has variables that are not justifiable, you can say, that are not standardized. So if anything happens, some vision threatening complication happens in camps, so that may lead to a very serious medico legal implication to the surgical team. So this model, it should be replaced by this hub and spokes model, where the patients are mobilized and screened from the spoke side, and they are transported to the hub side, that is the central hospital, where the cataract surgeries are taken by a trained and skilled workforce. So this model has various advantages, right from vertically integrated to cost effective and equitable. So this is has been successful in several parts of the country, and the replication of similar models should be done in the needy populations. Fourth is professional development for healthcare workers. So continuous education of the healthcare professionals, especially in the rural areas, and training and implementation of the high volume low cost cataract surgeries like manual small incision cataract surgery. And fifth is the research and data collection on the prevalence of preventable blindness. So continuous data collection and study on the prevalence and causes of blindness in India are critical for developing successful strategies. This data can be used to guide policy decisions and targeted initiatives. So the take home message, so a multifaceted approach is required to solve the issue, including awareness to research, and with the combined efforts of government, NGOs, healthcare professionals and general public, we can turn the tide against the rising blindness in India. So these are the references, and I will again end with Helen Keller. Alone we can do so little, together we can do so much. Thank you.
Thank you, Dr. Manpreet Kaur. Definitely, if we are, work in unison, we can achieve more. So that